My sister came to me, my sister Jessie. She was in her probably beginning of her 40s. She said, I need your help because I can't stop thinking about killing myself. And her son had already been diagnosed with schizophrenia, and he was in hospital. But even with Kaylin being diagnosed, our family had absolutely no vocabulary for mental health. We didn't really get it. And when Jessie came to me, it was a total shock. I had no clue. She was very good at keeping all, what she was going through from all of us. And we were lucky to be able to help her. And she was finally properly diagnosed when she was 50 with bipolar disorder with psychotic tendencies. And they found, both Kaylin and Jessie, when they came home, that the stigma around their illnesses was just as painful as the illness themselves. And Kaylin lost all his friends. Jessie felt that she was frightened to tell parents about her bipolar disorder because she was afraid they wouldn't allow their children to come and play with her young daughter at the time. So every day they were impacted, not only by some behaviors, but also by self-stigma, because they felt that they had been marginalized, they were full of shame. So we decided to do something about it, and we started Bring Change to Mind. And it's made a huge difference in my family. We now know how to support each other. We know all the signs, we're vigilant. But also, practically speaking, about the community health centers that we're really advocating for. When my nephew, when he was 17, had a psychotic break, they live in Montana, he had to be put in a straitjacket and drove in 2 hours to the closest place where he could get help. And of course, he went to an emergency room, and there was, an available bed, but that was lucky. So we've been very, very aware of first of all, the problem of people needing to get help. I was in the dentist the other day, and one of the dental assistants came up to me and said, do you know where I need help for my daughter? She's spiraling out of control and down. Where can I go? And it's just shocking to me. So this plan for me just makes sense, and it's so needed for people to know where to go and to get comprehensive care for mental health issues, behavioral health issues. And as far as my family is concerned, my sister and my nephew now have productive lives. They have learned how to manage their illnesses. But that's because they have a support group, and these kind of community centers would provide that kind of support on a long-term basis for people who need it.
You said your family